evening. Welcome to Soundhealth on Lagos Television. I am Olasumbo Modupe. It's third year since Nigeria recorded a polio-free status. The country celebrated the achievement with so much expectations and aspiration for more years to come. Today, we'll take a look at how to sustain this momentum in the country. The conversation begins after this break. Please stay tuned. It is still Soundhealth on Lagos Television. Joining us via Zoom this evening is Dr. Tunji Funsho, a physician and cardiologist, representative of Rotary to World Health Organization Africa and member of International Polioplus Committee of Rotary International. He is also the immediate past chairman, Nigerian National Polioplus Committee. Good evening, Dr. Funsho, and thanks for always obliging us.
Good evening. Thank you for having me. Happy to be here.
Last week, Nigeria celebrated a third year of being polio-free. What does this mean for the country, and how did we achieve this feat?
Thank you very much. I think what it means first and foremost is that we've saved children from being paralyzed by the polio virus. I think that's the most significant thing, which is the goal we set out to achieve right from the inception of the program in 1987. So that is a very, very big achievement. You recall at one time, we were recording more than 1,000 cases of children being paralyzed by the polio virus in a year. Now, for going on 6 years, we've not had any child being paralyzed by polio virus in Nigeria. So that's a great and fundamental achievement. Of course, as a result of that, we've learned a lot of lessons which we have now leveraged to tackle other diseases, particularly epidemic diseases like the COVID-19.
No doubt it is a milestone, a historic one at that. How did we achieve this task? Can you quickly give us an update on how the country...
Now, this achievement was brought about by a collaboration, which is, the greatest collaboration between the public and the private sector as far as health intervention is concerned. In 1987, the World Health Assembly formed, after a resolution, the Global Polio Eradication Initiative, which comprises, all countries, Rotary International, WHO, UNICEF, and latterly the Bill and Melinda Gates Foundation, and in more recent times, the Gavi Vaccine Alliance. So it's a collaboration with people in this, collaboration, bringing the different skills and resources to the table to ensure that every child is reached with the polio vaccine. It's been a long, tortuous journey with a lot of challenges, but we've been able to surmount that challenge because of the partnership I just mentioned and the willingness of our people to also take advantage of the opportunity to immunize their children against the polio virus.
Let the members of the public know what exactly is polio. They all hear polio all the time. They all hear paralysis and all that. What exactly is polio? How do we come about polio in children?
Polio is one of those viruses that are spread, through contaminated food and water. And the virus settles in the intestines. It multiplies and replicates there before it's carried into the bloodstream. And its prime target is the nerves that supply the muscles of movement, essentially. So paralysis can occur in any muscle of the body, but the ones that are most obvious are the ones paralysis of the limbs. But of course, it also affects you, like the muscles of breathing, which is the commonest cause of death. When the muscles of breathing is paralyzed, children cannot breathe anymore. And that is why we, in the early phase of the disease, in the 50s and 60s and early 70s, we had what we call the iron lung, where, people are put to help them to breathe whilst they're trying to get over the effects of the infection. So that is the main way the virus gets transmitted. And of course, from what I've said, you would surmise that the virus can only thrive in unsanitary environments. And of course, also find a child to infect who has not been immunized or has not been fully immunized. Or, like I said, normally say suboptimally immunized. In other words, having not received at least 3, of the oral polio vaccine. So that is the pathogenesis, of the paralysis by the polio virus. It gets into a child through drink or water that is not safe, containing the virus. It replicates, and of course, the virus now passes out in the stool and goes back into circulation again. Another child may partake, in water that has come from that source and gets infected again if the child is not immunized. So that is the growth cycle of the polio virus in an environment where children are not immunized and when there are no safe drinking water.
Aside paralysis, are there any other long-term concerns for children affected by this virus?
Well, unfortunately, there are no specific symptoms that one can see. The first time we actually get a suspicion that a child has polio is when you have paralysis. I must mention at this point is that it's not all cases of paralysis that is due to the polio virus. There are quite a number of other conditions that can lead to that. And that is why when we find a child with paralysis, we carry out stool tests at various levels until we confirm that actually there's polio virus in the stool. So the symptoms are generally what you find in a lot of childhood infections, which is, fever, lassitude, maybe of their drink, they become inactive, and sometimes they may, have diarrhea. And so the symptoms are non-specific, to polio. It can be caused by most other childhood infections that causes fever.
All right. Key players actually highlighted the role of primary health care centers in achieving this milestone. Looking at the settings in Nigeria, our peculiar settings, how do we enhance services at this center of healthcare?
Well, the routine immunization coverage it's relatively low in Nigeria and varies from one part of the country to the other, but the average is about currently now between 50 and 60%. We must state that in this, if you disaggregate, you find states in the southern part of the country, like Lagos State, having more than 80%, and some states in parts of the north having much less than 50%. Routine immunization coverage is very critical, and as you've mentioned, primary healthcare facilities are crucial to get, parents and caregivers to take their children for immunization. We don't have enough of those, and of the ones we have, they are not adequately staffed, and equipped, such that access to the vaccination themselves become a problem. So we need to increase, the number of functional primary healthcare centers in order to achieve a higher level of routine immunization coverage. Of course, we need to create awareness among parents of the need to actually utilize these facilities when we make them available.
From your response, it is obvious that the structure and the vaccines are there. How do we reassure parents, especially members of the public, on vaccine safety, the need to get these vaccines?
Well, vaccine safety, I think we have shown over time that the polio vaccine is safe. I think what we need to remember is that before any vaccine is licensed for use by the WHO, and of course we also have our own drug agency, NAFDAC in Nigeria, before they go into circulation. WHO at the national level and NAFDAC at the local level have to certify themselves, and these are professional people who make sure that the vaccine is not only efficient in protecting children, but also safe. And we have shown over the last 30 years plus that the chances of a child coming to any harm as a result of the polio vaccine is almost non-existent. The chance of complication is less than 1 in 2 million. And if you consider the number of children who will have been paralyzed if they did not get the vaccine, you find that the advantages far outweigh the disadvantage. So we need to continue creating awareness about the safety and efficacy of the vaccine. I'm sure with the success of the polio immunization campaign, people have realized that it's a safe vaccine, and of course, since we have using it, not seeing any more cases of the polio paralysis in our children in Nigeria for the last 6 years, it's also obvious that it's quite efficacious in doing what it to do.
How do we replicate this success in other health interventions like COVID-19, yellow fever, rotavirus, HPV vaccines, and other diseases that are not well highlighted in the society?
I think we're already leveraging, the all the resources that we have used for polio eradication, particularly in recent times, in COVID-19. The four-pronged approach of advocacy to governments at every level, to traditional leadership, to religious leadership, community leaders, and also community influencers, to promote the need for people to go and get themselves vaccinated against COVID. It's a polio structure that has been used essentially to ensure that happens in states across the country. So that is one area that we have found very useful, that we've leveraged the resources and the structure that we've used for polio eradication. And of course, recently you may have seen the launching, of the rotavirus to prevent diarrheal diseases in children against, structures that were set up for polio eradication. Our emergency operating centers have also been leveraged to also promote this round of vaccinations. Of course, we piggyback on activities like distribution of mosquito nets, measles vaccination, and the like. So we have actually leveraged a lot on those resources to impact positively on other infectious diseases.
We can't go to sleep for now. How do we sustain this momentum? We can't afford to go back to ground zero. How do we sustain this momentum?
Well, we have to continue doing what we have been doing or what we did to get to 0 cases now going on to 6 years. And that is why our current mantra is keep polio at zero. And the only way we can do that is to continue doing what we did to get to where we are today. And that is one, advocates continue reminding those in government, to continue prioritizing for every child to have access to the polio vaccine. That is one. And this is going to be government at every level, federal, state, and local government levels. And of course, we need to continue to advocate for the traditional leadership, our religious leadership, and to continue engaging with the communities to ensure that every child has an opportunity to have the polio vaccine so that they're protected against it. Funding is quite important. I know governments have a lot of priorities they will want to move on to, but we don't want to lose the gains that we've made with polio eradication. So we need to continue advocating to governments to continue making the funds available to ensure that the vaccine is available, the logistics are available, and we are doing house-to-house immunizations like we're doing in some states across the country, like Adamawa and Yobe, Taraba, Benue, Plateau, that government's counterpart funding is made available so that the logistic element of the program is paid for and in good time too.
All right, Dr. Tunji Funsho, thank you so much for your time and expertise on the program. We really appreciate you.
Thank you very much.
All right, continuous advocacy, funding, and routine immunization are recipe for a polio-free country. We hope that countries, key players will actually rise up to the expectation. I have been speaking with Dr. Tunji Funsho, a physician and cardiologist, representative of Rotary to World Health Organization Africa and member of International Polioplus Committee of Rotary International. He is also the immediate past chairman, Nigerian National Polioplus Committee. Thank you so much for your time once again. We now bring you up to speed with trending health report from around the world. Please stay tuned. Well, this is where we say thank you on today's episode of Sound Health. Remember, vaccines are safe and harmless. Get vaccinated, protect your child, especially against the polio. As we are recording, no polio cases doesn't mean that polio is still not out there. Get vaccinated, get your children vaccinated before the age of 5. For comments and inquiries, please send SMS to 08035826603. Follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.